Hi, everyone, and welcome to Mental Health Education. My name is Jessica, and I'm a medical student who believes in the power of education. I hope that through these videos, we will end some misunderstandings and/or fears about mental health. As a reminder, these videos should never be taken as medical advice. Please speak to your providers if you are in need of treatment for any type of illness. Today, we will be diving deeper into the illness known as obsessive compulsive disorder, commonly called OCD. Our case example is a 35-year-old male presents to a psychiatrist's office for the first time after urging from his family and primary care provider. The patient reports that he has been in treatment for generalized anxiety disorder and sees his family medicine doctor regularly, but that in the past year his feelings have been very different. The psychiatrist asks him to continue. He reports that his sister was hit by a car 1 year ago while she was jogging on the side of the road and passed away. He was so close with his sister and misses her every day. He, however, has become paralyzed by the idea of hitting someone accidentally with his car. The fear is so intense that sometimes when he is driving, he will have to pull over on the side of the road and throw up. He cannot get this thought out of his head and has been trying desperately to ignore it, but it never works. The thought is with him day and night on repeat, not just when he is driving. He is so upset with this thought and does not understand why he would want to think something like this. He asked the psychiatrist if he could wind up turning into a man similar to the one that took his sister from him. Our patient is likely suffering from OCD. Throughout this video, we'll explain the symptoms and criteria for OCD, and hopefully by the end, it will become clear how our patient fits the diagnosis. Studies have shown a lifetime prevalence of OCD among U.S. adults to be 2.3%. There are specific symptoms that a patient must experience in order to fit the diagnosis of OCD. First off, the patient must experience an obsession or a compulsion, or both an obsession and compulsion. An obsession is a recurrent and persistent thought, urge, or impulse that is unwanted and causes individuals marked anxiety or distress. Patients often attempt to suppress the obsession or to neutralize them with some other thought or action. Our patient is suffering from an obsession. His obsession is a thought that he will hit someone on the side of the road. A compulsion is a repetitive behavior such as hand washing, ordering, or checking, or a mental act such as counting or repeating words silently that the person feels driven to perform in response to an obsession. The repetitive behaviors or mental acts are aimed at reducing anxiety or distress or preventing a dreaded event. Our patient does not seem to have a compulsion. A compulsion he could develop would be pulling over repeatedly to check to see if he actually hit someone on the side of the road. The obsessions and compulsions must be time consuming, more than 1 hour per day, or cause functional impairment in our society. As always, the symptoms cannot be due to a substance or medication and should not be better explained by another medical condition, including psychiatric disorders. The exact cause of OCD is unknown, but it is thought to have both environmental and genetic factors. The neurotransmitter serotonin is thought to play a key role, though the exact mechanism is unknown. It is believed that most patients suffering from OCD struggle with the symptoms for an average of 10 years before being diagnosed. It is also believed that OCD is dramatically underdiagnosed, as many people may be embarrassed or feel unbelievable shame and thus avoid treatment. Our patients should be proud of themselves for coming and seeing a psychiatrist because treatments are available. First off, it is important for our patient to be reassured that everyone has horrible and at times downright disturbing thoughts, and that this is part of human nature. Researchers believe that we have these thoughts as a way for our brain to test different ways for us to act in situations and to come to the best solution. As with our patient, his brain may be thinking this thought to reinforce him not hitting people. He may have even had this thought before his sister passed away, but never gave it any attention. Now that he has had different experiences, however, he is focusing on the thought and has given it a false meaning. Therapy is very important for these patients because it can help them to come to solutions such as the one outlined above. A specific type of therapy called exposure and response therapy can also be very helpful. This is when the patient is exposed to a compulsion provoking situation and then tries not to carry out the compulsion. An example would be a patient that is deathly afraid of germs places their hand in a bucket of mud and keeps it there until they no longer feel anxiety. Patients, of course, need to work up to this point, but therapists will always be there to help. There are different medications that can be started in OCD, with the first line treatment being SSRIs. Providers, however, will always weigh the risks and benefits of starting any medication. Also, as always, healthy lifestyle modification should be explored with patients, such as exercising, eating a balanced diet, regular yoga and/or meditation, and getting enough sleep. I did want to take a moment and explain the differences between OCD and obsessive compulsive personality disorder. OCD is an ego dystonic disorder, meaning that it interferes with the person's goals in life. Obsessive compulsive personality disorder, on the other hand, is often seen as an ego syntonic disorder, meaning it is in alignment with the person's goals. Obsessive compulsive personality disorder was described briefly in my personality disorder video, but as a recap, it describes someone who enjoys order and perfection and may have a hard time doing things differently than they are used to. This is very different from OCD and has its own unique treatments. Overall, patients should know that if they are suffering from any type of illness, that they are not alone and that there are providers who will be able to help. If anyone you know is suffering, including yourself, the best thing to do is contact your local providers. Thanks everyone for watching.